Good morning, everyone. My name is Kendra Brown, and I am the president of the Upsilon, Epsilon, Omega chapter of Alpha Kappa Alpha Sorority Incorporated. On behalf of our international president, Dr. Glenda Baskin Glover, our North Atlantic Regional Director, Mary Bentley Lamar, we welcome you. Today, we are having and hosting our virtual summit, our first ever virtual summit, Turning the Tide, Taking Back Our Health and Our Wealth. I first want to pause and thank our wonderful speakers that we have lined up for today. Thank you to our wonderful committee that has led the organization of our summit for today. The purpose of our event is to educate our community by increasing their health and overall awareness in economic advancement during these economic times. Healthcare disparities have plagued our communities for generations. There is a significant racial disparity that is prevalent in access to health coverage and in health outcomes presently. Additionally, the racial wealth gap is constantly widening in America. The Brookings Institution is just one entity that does extensive research in this area. Their work has illustrated the growth of the wealth gap in America, which has been widening since at least the 1970s, as income levels stagnated for lower and middle class households while continuing to grow for households at the top of the spectrum. Centuries of racism and discrimination mean that this divide is widening, and it is a great deal wider for Black households that are denied the access to the opportunities and resources available to other households. Both the health disparities and the racial wealth gap must be reduced, and as a chapter, we are doing our part to ensure our community is informed and equipped with tools to turn the tide, take back our health and our wealth, and forge paths to positive outcomes. Thus, we sincerely appreciate you taking the time to join us today for these critical updates. Alpha Kappa Alpha Sorority Incorporated continues the mission of our founders, started over a century ago, by being of service to all mankind. Our chapter and our charitable arm, Ladies of Vision Charities Incorporated of Baltimore County, Maryland, have implemented a variety of community service programs, and this is one of such programs. Again, thank you to our attendees, our speakers, our chapter members, friends, family, and community for joining on today. We vow to continue our work making a difference and having an impact as we uplift and empower our community. So get ready for a wonderful, wonderful summit. At this time, we are going to have welcome videos from our Maryland speaker, Delegate Adrian Jones, and also a welcome from our Baltimore County Executive, Johnny Olszewski.
Hello, ladies of AKA. I'm Adrian Jones, Speaker of the Maryland House of Delegates. As our country continues to fight a global pandemic, health and the economy are at the forefront of everyone's concerns. My colleagues in the House and I are making an extra effort to support the health and economic success of residents in Baltimore County and throughout the state. We've taken actions to ensure that more Marylanders have access to health care. We passed a bill to shore up key provisions of the Affordable Care Act, finding more ways to expand telemedicine, and are working to lower the cost of prescription drugs. This public health crisis has also shown that investing in and securing education are more important than ever. It's the key to bringing back the economy and getting our communities back on track. Last session, we passed the largest one-time school construction investment and a once-in-a-generation plan to revolutionize education in Maryland. We also passed a bill to end the 13-year lawsuit around Maryland's historically Black colleges and universities. This bill provides critical funding that will help put our HBCUs on par with the other universities in the state. At the end of this conference, I hope you all leave with more ways to improve your health and create more pathways towards your economic success. Just know that in Annapolis, legislators are working hard to do the same. Have a great conference.
Hey everyone, it's Baltimore County Executive Johnny OLSZEWSKI. I know you were also hearing from our health officer, Dr. Gregory Branch, during today's keynote. but I wanted to take a moment to share my thanks and gratitude to everyone, Alpha Kappa Alpha sorority, for your Turning the Tide conference. You know, there's never been a year quite like this one, but despite these difficult and unprecedented circumstances, it's wonderful to see you all coming together to support the health and economic vitality of our communities. We shouldn't be surprised, though. Coming together in difficult circumstances is what AKA does best. And that's what we need right now. This pandemic has left so many of us hurting. So by empowering one another, we can come out of this stronger than ever. We're lucky in Baltimore County to have the UEO as a pillar of our community. You all have continued to exemplify excellence through your sustainable service, and this event is a testament to that. I look forward to continuing to work together with all of you in the months ahead and in the years ahead so that we can continue to build a better future for all of our families. So on behalf of the people of Baltimore County, I want to thank everyone at Alpha Kappa Alpha for all you do and wish you a wonderful event. Thanks again, stay safe and stay healthy.
Good morning. I have the pleasure of introducing our moderator, Dr. Nakiya Showell. Dr. Showell is a general pediatrician and assistant professor of pediatrics at the Johns Hopkins University School of Medicine. She is dedicated to a research and clinical career focused on addressing socioeconomic and racial ethnic disparities in child obesity and cardiovascular disease risk. Dr. Showell graduated from Bryn Mawr College with a BA in chemistry. She then received her MD from the Rutgers Robert Wood Johnson Medical School. Presently, she serves as a member of the Johns Hopkins Pediatric Residency Health Equity Track, the Pediatric Intern Selection Committee, and as a core faculty in the Johns Hopkins Center for Health Equity. Since July 2020, Dr. Showell has served as the Associate Medical Director of the Johns Hopkins Harriet Lane Clinic, where she focuses on clinical operations and expanding community engagement amongst patients and families in East Baltimore. Join me in welcoming our moderator, who is also the Vice President of the Upsilon, Epsilon, Omega chapter of Alpha Kappa Alpha Sorority Incorporated, Dr. Nakiya Showell.
Thank you, Mrs. Pettway, for that very warm welcome. And again, good morning. My name is Nakiya Showell, and I am the Vice President and Program Committee Chairman for Upsilon, Epsilon, Omega chapter. I'm so delighted to see everyone today, and I'm so honored to be able to introduce our two wonderful keynote panelists, Dr. Gregory Branch and Mr. Shawn Hart. Dr. Branch is the Director of Health and Human Services and Health Officer for Baltimore County. As a native of New York City, he graduated magna cum laude from the State University of New York at Buffalo School of Medicine and Biomedical Sciences. He completed his training at the Johns Hopkins Hospital in the William Osler Internal Medicine Residency Program and has practiced medicine for over 25 years. Nationally recognized as a certified physician executive, Dr. Branch earned the Master's of Business Administration degree from the University of Baltimore Merrick School of Business. He is currently on the faculty at Johns Hopkins School of Medicine and the School of Public Health, and is an adjunct professor in the Department of Epidemiology and Public Health at the University of Maryland, Baltimore. Please join me in welcoming Dr. Branch. Mr. Hart is a financial advisor in the Baltimore, Washington, D.C. region. He is currently the owner of Hart Wealth Strategies, LLC, which is headquartered in Timonium, Maryland. He has received degrees in financial investment risk management and accounting from Lincoln University. Mr. Hart's first entry into the financial services was on Wall Street as a stockbroker trainee at E1 Asset Management. Immediately following his opportunity there, he continued his career in financial services at Merrill Lynch. A native of Bronx, New York, Mr. Hart credits his father's subscription to the Wall Street Journal as one of the strongest influences in his life. He learned about finance and stock exchanges by reading the newspaper daily while in middle school, and by the time he entered high school, he was trading stocks on his own. Mr. Hart's career is based on a work ethic that respects clients' needs first and foremost, and focuses on their short and long-term goals with creative strategies. He has risen to the top since branching out on his own as an independent advisor, and has been recognized as one of the top producing advisors through his qualifications for the $1 Million Roundtable producer and an executive council. Join me in welcoming Mr. Hart. Dr. Branch, we will start with you with your remarks and followed by Mr. Hart, and then we'll field questions from our webinar participants as well as those who are following us on our social media platforms.
Good morning, everybody. I want to now take this opportunity to extend a virtual fist bump to everybody who's out there. A huge thank you to the president, Ms. Brown, and all the ladies of AKA for pulling together this wonderful platform on today. I know how committed this sorority is to your work. You guys probably know that the Chief Administrative Officer of Baltimore County is Ms. Stacy Rogers, and she is an AKA. And I'm just going to tell you guys, she's always talking to me and reminding me of all the things that you guys do. So I bring you greetings on her behalf. And I also have one of the coolest bosses in the world, our county exec, and you guys heard from him. But just like you as a director of Health and Human Services and the health officer, I am fired up about the services in Baltimore County. And this is especially true during this pandemic. This morning, I'm going to talk with you about several things that just to remind people that their health is their wealth. But in case you don't hear anything else from me today, I want you to remember the 3 W's. Wear a mask, watch your distance, and wash your hands. Wear your masks, watch your distance, and wash your hands. And let me move on. So I serve over 880,000 patients in Baltimore County because I consider all the residents my patients and my constituents. And I connect them through programs and services that are provided by the Department of Health, the Department of Social Services, and the Department of Housing and Community Development. I am the director of all of those areas. Every day, Baltimore County residents benefit from one or more of those programs offered in all those areas. And most people don't even recognize the role that Health and Human Services plays in their daily lives. So whenever I have the opportunity to speak before an audience like you, I like to share the simple truth that Health and Human Services is on the job in ways that many people don't even realize. For instance, health has been on the job in many places before you get there. We're already there in the restaurant before you go there. We're at the beaches, the community swimming pools, in the nursing homes, and in the hospitals, at the grocery stores, linking substance abuse users to programs, teaching family members how to save lives by administering naloxone, keeping the lights on in people's homes, keeping people's homes heated, checking on the children and the vulnerable adults, providing housing and preventing evictions, responding to COVID calls, and making services of referrals. We're distributing food stamps. We're securing health insurance. We are even there for your pets. So Health and Human Services is on the job. And then we want to work, we expand the public health as emergencies emerge. So let's talk about COVID-19. COVID-19 is a pandemic, and we began, believe it or not, tracing or tracking this virus in December of 2019. Now it's 11 months later, and we're still working to help mitigate the impacts of this unprecedented disease. COVID-19 is ubiquitous. It's everywhere. But even with that, we recognize that COVID-19 disproportionately affected the African American community. African Americans represent 13% of Baltimore County population, but accounted for more than half of the people to succumb to the disease. And as a result, we collaborated with the Maryland Partnership for Prevention and the Maryland Department of Health to provide special outreach to communities that were hardest hit. We distributed what we called our safety kits. And those kits contained educational materials about the virus, personal protective items like gloves, hand sanitizers, masks, paper soap, and we set a goal to distribute 100,000 kits by December 2020. Well, we met that goal and exceeded it in July, and currently we have now distributed over 150,000 kits. Another vulnerable group that people don't tend to think about is the homeless population. We had to rethink early how we were going to provide services to the homeless population. Obviously, we just couldn't keep them all together, especially the ones who were high risk, who were the older ones who had medical illnesses. So we immediately, the first jurisdiction, we relocated our vulnerable individuals from the homeless shelters, and we put them into hotels and alternative accommodations. I say that to you because I can tell you that we did not have an outbreak of COVID with our homeless population in Baltimore County. And I'm very proud to be able to say that because we actually did what we had to do with that population early on because we knew that they were going to be very, very vulnerable. One of the other things that we're doing in Baltimore County is making testing readily available and convenient and accessible and free for COVID. So we're providing COVID testing 5 days a week throughout Baltimore County. And if anybody wants to go online, they can go online to baltimorecountymd.gov, 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 and they can learn about where all of those particular testing locations are. We confirmed the first Baltimore County case in March of this year. The first Baltimore County case was in March. Today, there has been 18,213 cases in Baltimore County. 18,213 cases. And just a few weeks ago, I personally was one of those many confirmed cases. I got tested because I was showing symptoms of mild cough. I was losing my voice. I had a little fever and some body aches. However, I'm glad to say that I was blessed and made a full recovery. Unfortunately, too many others cannot say the same. There have been 609 Baltimore County residents who have died because of COVID-19. 609. What people must understand is that COVID-19, it's real, it's here, and it is potentially deadly. And at this time, we don't have a vaccine, we don't have a cure, and we don't have real verifiable treatments. So that's what I have to say. Guys, remember, if you don't remember anything else I say, remember the 3 W's. Remember those: wear your mask, watch your distance, and wash your hands. And one other thing I just want to mention, if you're not feeling well, stay at home. Stay at home. Don't bring it out to transmit it. Because as I mentioned, COVID is ubiquitous and it is everywhere. I had a relatively mild case of it, but I would not want to wish that on my worst enemy. So let's talk about President Trump. That didn't come out right because I didn't mean he was my worst enemy. So let me just say that the president and the first lady are in my thoughts and in my prayers. And I extend my best wishes to them for a very, very speedy recovery. But what you need to know is that regardless of what they tell you, I'm going to say to you that the president is sick. he is ill. They report that he's working from the Walter Reed Hospital. But let me just say this. The White House has its own little mini hospital, and they're quite capable of handling all minor illnesses right there on site. They're treating him with all types of experimental antibiotic treatments. And they're also giving him remdesivir, which is usually given to patients who are very sick and on oxygen. So they're working very hard to treat our president. But I need you to understand the president's sick, because if he wasn't that sick, they wouldn't have transferred him to that hospital. And they didn't transfer the first lady, and she got it. So we should keep him in our thoughts and in our minds. But I just want everybody to understand that when somebody's exposed or is positive for COVID, when somebody is positive for COVID, they have to reach out to everyone that was in contact with that person. So everybody who was in contact with the president for more than 15 minutes, for less than 6 feet, they need to be on quarantine for the next 14 days. And that would include the Vice President Pence. If he was in that close contact for the next 14 days, he really needs to be quarantined. Even if he tests negative, he would need to be on quarantine, which means that the upcoming debate between the Vice President and Kamala Harris, who, by the way, I know is a dynamic AKA. The AKAs are just showing out, and that's a wonderful thing. But even with that, we've got to understand that that debate may have to be canceled. So it's clear that COVID is ubiquitous, but it's also clear that COVID has no respect for any person. So what does that mean? It means that the holidays are quickly approaching, and we must rethink how we think about the traditional ways of celebrating. For instance, we talk about Halloween. We've got to understand that we say trick or treat for Halloween, but quite frankly, we don't want no tricks, which this year could be the COVID virus. We really want the treats, which is the candy. So we got to understand that we're not out of the woods yet, and really our children should not be going door to door, interacting with people like that. I will say to you that as the health officer, I do not recommend that we do that, because as you can see, even with the president and everybody interacting with one another, COVID is ubiquitous and it is here. So we're approaching the flu season right now, and I have to encourage everyone, please get your flu shot. And in fact, that's your assignment today. I will just say to everybody who's listening to me, get your flu shot in the next week or two. You can get it almost anywhere, any of the pharmacies, grocery stores, your doctor, urgent care center. Baltimore County will be giving them out. All other health departments will be giving them out. Tell your neighbors and let everybody know you should get your flu shot. I also will say to you guys, the 3 W's again: wear your mask, watch your distance, right? We've got to continue to do that, washing your hands frequently. Why do I tell you all this? Because your health is your wealth. Thank you so much for listening to me. God bless each and every one of you. And thank you for all that you do, AKA.
Great. Thank you so much, Dr. Branch, for those illuminating remarks. We have the 3 W's: wear mask, wash hands, and watch your distance. I have that down, and I'm going to use that. Thank you so much. So we're going to transition to Mr. Hart, and Dr. Branch, we do have questions in the Q&A for you, but we're going to entertain those at the end, okay? Mr. Hart, and just keeping mind of the time, because we want to make sure we have time for questions. You have about 7 to 8 minutes. Mr. Hart.
Number one, thank you so much for Lee's Alpha Kappa Alpha. Thank you so much, Madam President Brown, and thank you so much, Madam President, Vice President Showell. So definitely thank you so much for allowing me today to definitely speak to you guys about, especially speak to everyone about wealth. So I want to say thank you so much for Dr. Branch for definitely giving us those 3 W's. I think those are very, very powerful words that you have mentioned. I think you spoke to the heart of this country today. So definitely thank you for that. I definitely want to talk about today when it comes to wealth, right? Within our Black community, I'm definitely going to speak to that because that's dear to my heart. Because I'm from, environments where a lot of us don't get a lot of opportunities. So I'm definitely going to speak about wealth. When it comes to wealth, they said that to close the wealth gap, it would take 228 years to close the wealth gap, right? But one thing that they didn't mention to us, if we do nothing, right? So if we do something, we could close that wealth gap a little bit more closer, a little bit more sooner. So the one thing, there's 4 P's that I definitely want everyone to walk away with, just like Dr. Branch, 3 W's. Protect, plan, prioritize, and pass. And I'm definitely going to talk about all those avenues and what exactly those mean, right? So as we all know today, we're definitely in a different time. It's a lot of tremendous pressure on families, individuals. It's a lot of pressure just to keep food over your heads. Roof over your heads, food inside the refrigerator, making sure we educate our children from home, and also planning for our future as well. Just because COVID happened, that doesn't mean that we have to stop planning towards our life, right? It just makes things more difficult. So sometimes we need a little bit more guidance. It's what I call is a roadmap. So I'm definitely going to talk about the 3 P's. So when we start talking about protect, one of our things that COVID definitely exposed was the biggest asset that we have to protect is us, right? So God forbid, if I'm living with a spouse and we have children, and let's say I'm the breadwinner, I have to make sure that God forbid I don't make it home tomorrow, my family is still able to live the same lifestyle as if I was here or not here. As a responsible human being, that's what I would do, right? Regardless of what. So when we're talking about protecting, we also want to protect what we earn, what we own, who we owe, and those that we love, right? So once we start talking about that, we have to start planning, right? And planning can come from different avenues. There's no one size fit all. I think everyone's a little bit different when it comes to that category. The next P that I want to talk about is plan, right? A lot of times, this is what we're planning for. So we plan for major purchases. We plan for vacations. There's a study show that people plan for a vacation more than they plan for their financial life, right? And when I look at that, I always say the vacation lasts, maybe a week tops, right? For most Americans, vacations will last a week. But retirement lasts, so for most people, on average, 35, 40 years. How are we planning for that? And how do we protect that, right? Understanding that $4 trillion just went out, and I think they have another $4 or $5 trillion on the sideline that may go out as well. One thing I would definitely look at is we know that taxes are going to go up. It has to go up, right? In order to keep the country sustainable, it has to go up. So the one thing I want to ask is, how are we planning for ourselves as taxes increase, right? Do we wait for taxes to increase, then we start planning, or do we plan now and waiting for the taxes to increase and making sure that everything is in order? So I always tell people to plan for the major purchases, right? Where it could be a home, emergencies. There was a study went out that says that the average American doesn't have $1,000, right? And to me, I find that a little appalling, right? I feel like people can have that with the proper discipline, right? When it comes to wealth, it's all about discipline. If you pay your cable bill every month, I could at least put $10 away for myself every month, right? And I look at reallocating of money, not spending extra money, right? So I always like to sit there and write down my budget. Write down your budget and see exactly what what am I spending money on? I think the COVID definitely showed us how that we can save money, right? A lot of us are home. A lot of us aren't going to the coffee runs every day. People have more money inside their bank account. Not all, but just some people have more money inside their bank accounts because they're spending less. So I think what COVID did, like I said, I'm not talking about the lives that was lost because that was a tragic thing, but it really showed us that if we really, really sit back and reduce our spending and reallocate our spending elsewhere, we could see our overall net worth really, really rise. And I know I mentioned earlier about talking about the wealth gap. So I'm gonna say something towards the end that really, really speaks to that wealth gap and how it can be closed with just a plan. Next P I'm going to talk about is prioritizing our goals. So as we prioritize our goals, we have to look at diversifying our risk, right? And what does that mean? They always say don't have all your eggs in one basket, right? And I always tell people, yes, don't always have all your eggs in one basket. Sometimes people may say, hey, I'm going to go with this investment company, this investment company, this investment company. That's really not diversifying, right? Diversifying really mean that if you go with 3 different investment companies and we're all doing the same thing, is that really considered diversifying? When we talk about diversifying, I like to make sure that our strategies are diversified. I think we have to really, really home in on that. When we talk about our strategies, more than our investment strategies, are we saving out of every paycheck, right? How much are we saving? Everyone numbers is different. I always say save what you know that you can feel comfortable with, right? For a person that makes 30,000, 50,000, 100,000, our levels are different, but our disciplines and principles are the same if we look at it, right? So as I start to go on and talk about that, I always tell people maximize your 401k plan, or your 403b, 457, wherever you work at, federal government, TSP. I always tell people to maximize that. And what I mean by maximizing, if your company is matching you at 4%, the minimum you should put into that 401k plan or retirement account is 4%, right? Because what happens now, we always talk about this wealth gap, right? So if the company is matching, we have an opportunity to go ahead and bridge that gap with 4% extra money. Right, so I always tell everyone to make sure you maximize that. Now, what you do after that in regards to planning, that's just a whole different ballgame. But at least do the bare minimum to have something later on. The last thing, also when you talk about prioritize, we also have to look at inflation. We all know that 20 years ago, I know from me for a fact, 20 years ago, I was looking at it for a loaf of bread was 79 cents, 89 cents. We all know the 99-cent bread. We can always get it. Now, bread's like $3-4. And when you look at bread, and I use that analogy so vast, and I'm still serious about it because it speaks to everyone, right? It speaks to the things that we used to buy back then, we can't buy now. I mean, back 20 years ago, $1 million, even though today is still a lot of money, the $1 million was like, oh my God, it was a dream. Now everyone feels it's obtainable. I can make $1 million, just by doing what I'm supposed to do and different investments and etc. So I definitely want to tell everyone to just be mindful about inflation. Whenever you're planning, plan for inflation. And the last P I would like to go ahead and pass on is basically pass, right? And what does that mean? Pass along your assets. See, a lot of times, we talk about this wealth gap, and this is what I'm spending a little bit more time into. We talk about the wealth gap, and we don't understand that we can close that wealth gap if we do something, right? So they say, quote unquote, and I have my own personal opinions about this. It says 50 million people in this country, the United States of America. We're talking about 50 million Black people. Let me clarify. So I go back and I said, okay, it's 50 million Black people. Just imagine if the African American people in this country, if 15 million of us bought $1 million life insurance policy, just 15 million, that is $1.5 billion economic impact going back into our community. So now when I talk about economic impact, it's just not say, hey, let's get the life insurance. When we die, the money gets to go back into our community. It's a little bit deeper. Let's take it a step further. Now we have to talk about what it means to be financially savvy, right? Understand what money talk is. Understand how taxes operate. Understand how business operate. Understand how to invest, not just in the stock market, but maybe I want to go ahead and invest with a friend of mine that's opening up a business, right? Maybe I want to go back and invest into someone that's opening up a beauty supply shop, which is a $1 trillion industry, right? If everyone, all the beautiful ladies on this call, I already know that it's a $1 trillion industry, right? Because we all use it. So when I look at that and I talk about putting the money back into our community, see, now what that does is set our next generation up for it sets the next generation up for more wealth, right? And the thing about it is, we got to start doing something to close the wealth gap. If we don't do nothing to close the wealth gap, nothing will happen. They said in about the year 2028, 2030, they said that the average household black wealth will be zero. And I refuse to sit back and let that be just let that be true. I refuse for that. So my thing I will always leave with everyone is make sure that you protect what you own, right? And those who you love. Make sure you plan for everything, right? The same way we could plan for vacations, let's plan for our major life events as well, right? And we'll also prioritize, right? Sometimes, we may want to go here or buy this or buy that, but it doesn't work within the budget right now. We may just have to hold it off or save for it, right? And it's okay to live in that space. I think society put a lot of pressure on us to say that we have to keep up with the Joneses, but I'm here to tell you, it's okay. We don't have to keep up with the Joneses. It is really okay. You will be fine. I guarantee it to you. And also, last thing I would definitely say, pass on the legacy, pass on the assets. That's why, we talk the Rockefellers. We're talking about other families have lived on. Their legacy has lived on, all because they have passed on their assets in a more effective way. Thank you so much.
Great. Thank you so much, Mr. Hart, for those remarks. It was very informative. So we have the 4 Ps: protect. Let me see if I can remember. Protect, plan, prioritize, and pass.
There you go.
Awesome. I got it. And that was without looking. Thank you. So we are going to entertain questions. And I know we have a few questions from the audience, but before we get started, I just wanted to get some dialogue going and pose a question to both of you. Just in light of our theme summit and thinking about the interconnectedness between physical, emotional, and financial wellness, I wanted to pose a question that I think both of you can speak on for our audience. So the Business Insider in 2018 quoted that Mr. LeBron James, Lakers player in the finals, spends on average $1.5 million per year on his body. He has chefs, he has trainers, he has a home gym that mirrors that of the NBA gyms, and his career earnings are over $1 billion. So it's evident that he treats his body like an investment, what will turn the ultimate health and wealth workout routine, right? So given our theme and reflecting on that example, Dr. Branch, can you give an example of maybe one of the best health investment strategies that those in our audience can employ now to improve their long-term health status? And similarly, Mr. Hart, can you discuss what you think the best financial investment strategy is that we can do? And considering that we're in unprecedented times, and I want to make sure that we are providing context for all of this, that we are in a very unique and unprecedented time. But what can we do now in the short term to think about where we want to be from a longevity standpoint?
So I will say to you that one of the things as a physician, and I'm an internist by training, and I would talk with my patients all the time. And I think one of the most critical things that we can do, and it doesn't take the millions of dollars that folks who have that kind of money do, and that is, I think it's so important that we understand and recognize our food intake, our diet, period, point blank. I'm not talking about you got to go to the gym. I'm not talking about you got to just watch what we eat. But I'm going to say this. I'm speaking to a lot of women now, and I'm going to say this. we've got to watch it for ourselves, but we've got to teach it to our children.
Mhm.
And I think that if we start to do that generationally, we will become a more healthy people. People will say to me, you know, diabetes run in my family. Yeah, but nobody in your family runs. You've got to understand that it starts with you. And so we don't need millions of dollars like LeBron. Basically, we need to watch what we eat. And I think that's going to make a huge difference.
Mr. Hart.
Absolutely. Definitely. LeBron James is one thing that I took away from that is he protects what pays him and protects his family, right? And we all know that they live a certain lifestyle and everything else like that. So we also always want to protect. So when I look at LeBron and look at his health and everything else like that, he's protecting his major asset, which is him, right? And he's making sure he's feeding himself correctly. So when I look at when I look at us as everyday people, how can we protect what we do? I think it really comes by knowing, it comes from education, number one, understanding what financial tools that we need to protect ourselves. And also, one of the biggest thing is discipline. I think what LeBron James and the average American can definitely agree on and meet in a common place is discipline. Anything that we do at a disciplined rate for a long time, we know that it will always work out. So that's what I would definitely say. Save your money. I don't care if you put $10 away a month or $100 away every month consistently for 20 years, you will see growth. That's my take.
Thank you, Mr. Hart and Dr. Branch for that. We do have a few more questions in the last couple of minutes. No, Madam President, you have a question for Mr. Hart.
I do. And thank you both so much for your comments. So I want to ask the median income in the United States of America, the salary, right? And I'll just pick the age range of 35 to 44 is $58,916. And so I want you, Mr. Hart, to speak to that family, right? To speak to the family who has the average salary on tips that they can do. You know, folks who may not be in, you know, the $1 Million Club. You know, I know that I'm not in the $1 Million Club. And so just speak to the average family on ways that they can teach our children, you know, how to save, maybe by getting or having a savings plan as a child, and, you know, teaching them how to save, you know, quarters and dimes and dollars and their weekly allowance. But how do we instill that in our young people, and how do we model that behavior for our young people when for some families it seems like there are more bills than there is salary, right? So how do we empower and encourage that family?
Thank you, Madam President. So yes, I would definitely say that I don't care how wealthy you are. Everyone always wants more. So how really rich are we? That's just number one, right? And I look back and I said about the average American makes $58,000 a year. One thing I would definitely look at is prioritize. We have to prioritize our goals. We have to know what we want. We have to know how we want to go ahead. We have to know how to go about it, right? And I think it leads with education. See, when it comes to kids, and you know, kids always model and demonstrate their parents, right? So if my parents model and demonstrate discipline in regards to savings, or in regards to different you know, good behaviors, eating habits, all that stuff, what happens is kids normally follow suit. I could definitely say that because my father, right? My father, my mother, they are stewardess of always saving something, right? So I definitely model and they model and demonstrate it for me. So I would definitely talk about the average American. Sometimes we have to put a budget down. It's a simple principles. There's no magic sauce. There's no magic words. There's nothing I can say that will help you except for knowing your numbers. Right? If we know our numbers, we know what to cut and what not to cut, right? So for example, if we're paying a high cable bill of $250 a month, and we know that we're only watching 2 or 3 stations of the cable channel, why not customize our package to fit that mold? Right, so I look back at that and talk to the average American there. Most places don't offer 401ks, but guess what? Now you can do an IRA. So I would definitely say the average American put something away, right? Go into Google search and type in IRA or retirement account or investment account, and tons of stuff will pop up for you to educate yourself on how to really start investing, right? And let me tell you something: a little bit of money, maximum amount of money, no money it's not worth it.
Great. Thank you, Mr. Hart. We have a question for Dr. Branch. Dr. Branch, you mentioned that a very vulnerable segment of Baltimore County are those who experience homelessness. Do you have any suggestions on how we can support, as community members, support those members either by mass donations, I think in particular, or for those that are in need, staying in hotels or who need residence?
Okay. Oh, yes. So we have a couple of agencies that oversee our shelters in Baltimore County, and that's CAN, which is Community Action Network, and St. Vincent de Paul. And you can call CAN, and they will accept donations. You can call CAN by calling 410-285-4674. 410-285-4674, and you can call St. Vincent's de Paul at 410-662-0500. 410-662-0500. You can just call both or one of those, and they'll tell you exactly how you can assist in any way that you would like to.
Great. Thank you. And you mentioned some of our community partners in that, and they have been actively and very proactively supporting those community members who are experiencing homelessness. Thank you. One question for Dr. Hart, for Mr. Hart. Is it best to prioritize, due to the pandemic, paying off debt or growing your emergency fund?
I really go back and I say, there's not a right or wrong answer to that. Right? It really all depends on what your financial situation looks like. I'm a big advocate for paying off debt, but I'm a big advocate paying off debt that's really killing our pockets, right? As most people, we are people of celebration. So when we celebrate small things, it's like a snowball effect. So I'm a big advocate now for paying off the smallest debt. Because once we accomplish that smallest debt for paying off, now we feel like it's a victory that's won. Now we're more encouraged and empowered to go and tackle the next level of debt. I'll always say put something away for emergency funding. So I'll always say, hey, always have 3-6 months worth of living expenses saved on the sideline. Most people don't have that. Most people, it's hard to do that. I would say consistently and being disciplined over the course of time, you will get there. And if it requires you to pay $50 a month into an emergency fund account, that's where you are until you get to that point. So discipline and having faith in what you're doing.
Awesome. Thank you so much. So we are quickly running out of time, but I want to just take a minute for Dr. Branch and Mr. Hart to give some final remarks, just 1 minute, while we transition to our next segment of our summit. Dr. Branch?
Thank you guys so much for inviting me. It was a pleasure to be here this morning. All I can say, and hi, Kathy Pettway, my good friend. All I can say is remember the 3 W's. You know what I mean? Wear your mask, wash your spaces and all that kind of stuff, and wash your hands frequently. God bless you, ladies.
Thank you, Dr. Branch. Mr. Hart?
I would definitely say thank you so much, ladies, for definitely having me today. The one thing I would definitely walk away with is definitely the 4 P's: protect, plan, prioritize, and pass. When you prioritize your goals, when you set your goals, prioritize your goals, and you have to initiate a strategy of action plan. I think that's the key, is an action plan. Review and update your strategies regularly, right? We have to know what we're doing regularly. And also, making sure that you just don't listen to he say, she say. Always do your research and make sure that you talk to the proper professionals to help you and navigate through these tough times. That's it.
Awesome. And Mr. Hart, you reminded us of an initiative that we have going on starting October 8th. Every year we offer the Dave Ramsey Financial Peace University, and we usually partner with Life Builders Church, which we're doing this year. And this year we're doing it virtually. And starting on this Thursday, we are going to be offering it virtually for 9 weeks. And I can show you, for those in the audience, here's a flyer. So, and we're going to be talking about exactly some of those principles that you discussed. So join us, there's information on our website.
So thank you so much, Dr. Branch and Shawn Hart, for that engaging conversation. We learned so much. Wear a mask, wash your distance, wash your hands. We have our 3 W's and we have our 4 P's: protect, plan, prioritize, and pass. We are going to take those and share them with our community. Again, thank you so much for spending time and engaging and helping us all with our health and our wealth this morning. Thank you.
Thank you.
Awesome. So we have come to the conclusion of this portion of our morning. And again, I just want to sincerely thank Dr. Branch and Mr. Hart for this wonderful, wonderful, wonderful discussion. But we're not done. The summit continues, and we have 3 exciting breakout sessions starting at 11:15. And if we could bring up the slide with the links, direct links to each specific section, and we can review instructions, that would be great, technology. Wonderful. So we have 3 exciting sessions coming up: Black Business Surviving and Thriving. There's the link that you can type in, and we'll also, for those on Facebook, we can put those on our Facebook chat. Emotional well-being during COVID-19, and 2 pandemics, racism and COVID-19. So we hope to see you in one of those sessions, and you can go to different sessions just by using the links. And as a reminder, to please submit the survey that you will receive. We would love your feedback and input about our summit today, and we look forward to seeing you at our future events.